In this video today, we're going to talk about synovial cysts, how they cause pain, and what the heck is it? If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist. And what on this channel, Cutting Edge Pain Relief, we endeavor to do is to help patients understand why they have pain, what to do about it, and how to punch pain in the face and get back to leading the life that they deserve. Today's topic is synovial cysts and what exactly are they? So synovial cysts are collections of fluid that form within the context of the spine. And they're traditionally associated with something that's called a facet joint. And so that facet joint is as follows. If we were to take a look at the context of a spine, and we can be able to see and pick out these joints that you can see where this pen is pointing that allows for you to be able to have mobility and changes, that is what actually can cause a problem as we age and mature. Traditionally, synovial cysts don't occur before age 50, but they can occur after that time because there's degradation of the joint, which can result in damage to something that's called the synovium, which is the lining of the joint. And those joints can then form a collection of fluid. And that collection of fluid can cause all kinds of issues and problems. Most specifically, it can mimic something that's called spinal stenosis. If you have questions about what spinal stenosis is, check out this video that's linked here. But spinal stenosis, in summary, is a narrowing, particularly of the areas that exist in and around the areas of the spinal canal. So if we were to take a look at this again, and we take a look here, we can see this is the spinal canal. The facets sit in these areas in here, and we have a collection of fluid. It can cause pressure in that area that can cause a whole host of problems and issues. So when the spine breaks down, it can produce more fluid than a healthy joint. Some of the risk factors are going to be things like being an older individual, deterioration of the spine, whether it's due to trauma or through wear and tear, and typically those who are over the age of 50. Symptoms are pain in the lower back, sometimes pain in one or both legs, pain that radiates down the back of the leg into the feet, painful cramping in the legs, numbness or tingling in one or both legs, increased pain can occur that's associated with standing and sometimes is relieved with sitting. So what's the difference between a ganglion cyst and a synovial cyst? Where ganglion cyst is a fluid-filled sac that's normally developed somewhere in the wrist or the feet or ankles, while synovial cyst has a thin film of tissue around it. A ganglion cyst doesn't have this degree of tissue that surrounds it. Some of the things that are most problematic or concerning is if the synovial cyst results in pressure on an area that's called the cauda equina, which can cause numbness, weakness, and other symptomatology that needs to be evaluated promptly by a physician. Synovial cysts are traditionally treated with conservative therapy. Sometimes you wait to see if they will resolve on their own, but sometimes they can actually be treated with either an epidural injection or a facet injection, or depending on the physician and what their degree of expertise might be, you can try and be able to do a treatment that involves both an epidural and a facet joint injection to be able to target that cyst from two different vantage points to try to see if you can relieve its pressure. Occasionally and rarely, synovial cysts need surgical resection in order to be able to get improvement. Question of the day: have you had a synovial cyst that has caused you problems? And if so, what were some of the symptoms that you had that were associated with it? And more importantly, how did you get it fixed? If you like videos like this that explain why you have pain, how to beat it, and how to get back on your feet, please hit the like button. And if you're interested in learning more, please hit the subscribe button so we can be able to explain to you how to be able to punch pain in the face and how to get back to leading the life that you deserve. Thank you.